Poor sleep is common, but some patterns are real red flags. The key question is simple. Is your sleep problem just annoying, or is it starting to affect safety, health, or daily function? If you're routinely struggling to stay awake while driving, that's not just tired. If your mood is shifting, your focus is slipping, or your body feels run down for weeks, it's worth taking seriously. Sleep is not only rest, it's active repair for the brain, hormones, immune system, and metabolism. So when sleep breaks down, other systems often start to wobble too. In this guide, you'll learn the specific warning signs that deserve attention. You'll also learn what they can point to, and what information is helpful to track before you talk to a clinician. The goal is calm clarity, not panic. By the end, you'll know which sleep issues you can work on with habits. Moving to slide 2. First, separate bad nights from a real sleep problem. Almost everyone has rough sleep after stress, travel, illness, or a noisy week. That's normal variation. A red flag is frequency and persistence. If trouble falling asleep, staying asleep, or waking too early happens at least 3 nights a week, and it's been going on for 3 months, clinicians often call that chronic insomnia. You don't need to self-diagnose, but the timeline helps you decide when to ask for help. Another red flag is impact. If sleep issues are dragging down your work, school, relationships, or motivation, that counts. Also, pay attention to compensations. If you're relying on long naps, heavy caffeine, or constant catch-up sleep to function, your baseline sleep may not be restoring you. Track 2 things for a week: your bedtime and wake time, and how you feel mid-morning. That simple data can reveal patterns fast. Moving to slide 3. One of the biggest red flags is excessive daytime sleepiness. This is different from feeling a little sluggish. It's the kind of sleepiness where your head nods during meetings, you drift off while reading, or you feel a strong urge to sleep in quiet situations. The most serious version is drowsy driving. If you've had close calls, missed exits, or fought to keep your eyes open behind the wheel, treat that as urgent. Excessive sleepiness can come from too little sleep, but it can also point to sleep apnea, restless legs, circadian rhythm problems, medication side effects, or other medical issues. A helpful self-check is consistency. If you get a full night in bed and still feel dangerously sleepy the next day, that's more concerning than a single short night. Write down when sleepiness hits hardest: morning, afternoon, or evening. That timing can give clues about what's driving it. Moving to slide 4. Another red flag is loud, habitual snoring, especially when it's paired with pauses in breathing. Many people snore sometimes, but consistent loud snoring can be a sign that the airway is narrowing during sleep. If someone has told you they hear choking, gasping, or long quiet gaps followed by a snort, that pattern is particularly concerning. Obstructive sleep apnea is common, and it can fragment sleep even if you don't remember waking up. Clues you can notice yourself include waking with a dry mouth, morning headaches, or feeling unrefreshed despite enough hours in bed. Some people also wake up to urinate more than expected. Sleep apnea is not only about sleep quality. Studies link untreated apnea with higher risks for high blood pressure and metabolic problems. If these signs fit, it's worth discussing screening options with a clinician, especially if you also have daytime sleepiness. Moving to slide 5. Pay attention to what happens during sleep, not just before and after. Unusual behaviors can be a red flag, especially if they're frequent or risky. Examples include sleepwalking, acting out dreams, or waking up confused and disoriented. Occasional sleep talking is usually harmless, but complex behaviors, like leaving the room, eating, or trying to do tasks, deserve attention. Dream enactment is important to flag. If you or a bed partner notices punching, kicking, or sudden movements that match vivid dreams, that can be different from typical tossing and turning. It may be linked to REM sleep behavior disorder, and it's worth discussing with a specialist. Safety is the priority. If there's any chance of injury, consider practical precautions while you arrange an evaluation. The useful details to record are frequency, what time of night it happens, and whether anything triggers it, like sleep deprivation, or certain substances. Moving to slide 6. Let's talk about insomnia that comes with racing thoughts and rising anxiety at night. Many people lie awake sometimes. The red flag is when it becomes a cycle you can't break, and it starts shaping your whole day. If you dread bedtime, watch the clock, or feel your heart rate climb as soon as the lights go out, that's a sign your nervous system is learning to associate bed with stress. Another warning sign is spending a long time in bed awake, then trying to compensate by sleeping in, napping, or shifting your schedule wildly. That often backfires and keeps the cycle going. It's also important to note if insomnia begins suddenly and persists without an obvious trigger, or if it's paired with panic symptoms. Insomnia is very treatable with structured behavioral approaches, but persistent cases deserve assessment to rule out contributors like depression, anxiety disorders, pain, reflux, thyroid issues, or stimulant use. Moving to slide 7. A different category of red flags is a shifted body clock. If you can't fall asleep until very late, then struggle to wake for obligations, you might be dealing with a delayed sleep phase. If you get sleepy extremely early and wake up before dawn, that can be an advanced sleep phase. These are circadian rhythm patterns, meaning your internal timing is out of sync with your required schedule. The red flag is not the preference itself, it's the mismatch and the consequences: chronic sleep loss, repeated lateness, or constant social jet lag. Another clue is that you sleep much better on free days, but your schedule collapses on work or school days. Circadian issues can also show up after shift work or frequent time zone changes, but they can persist even without those. A clinician may ask about light exposure, meal timing, and consistent wake times, because those are strong signals to the body clock. Moving to slide 8. Restless legs and nighttime limb movements are another set of signals people often miss. Restless leg syndrome usually feels like an urge to move the legs, paired with uncomfortable sensations that get worse at rest and improve with movement. It often peaks in the evening, right when you're trying to fall asleep. Some people also have periodic limb movements during sleep, which can fragment sleep without them realizing it. The red flag is frequency and impact: long sleep onset, repeated awakenings, or a bed partner noticing rhythmic kicking. Restless legs can be associated with low iron stores, certain medications, pregnancy, kidney disease, and other factors. That doesn't mean you should assume a cause, but it does mean it's worth mentioning to a clinician, because targeted testing is sometimes appropriate. When you track symptoms, note the time of day, whether movement relieves it, and whether it's worse after caffeine or intense exercise. Moving to slide 9. Nightmares and night terrors can also become red flags, depending on the pattern. An occasional nightmare is part of normal life. The concern is when nightmares are frequent, intense, and start to create fear of sleep, or when they're linked to trauma symptoms. Night terrors are different. They often involve sudden screaming or panic with confusion, and the person may not remember it clearly.
If these episodes are happening often, causing injury, or leading to serious sleep loss for you or a partner,
it's worth professional input. Also watch for a sudden change. If vivid nightmares begin after a new medication or after stopping a substance, that timing matters and should be discussed with a clinician. Sleep and mental health are tightly connected. Poor sleep can worsen anxiety and depression symptoms, and those conditions can worsen sleep. The goal is to notice the loop early before it becomes your new normal. Moving to slide 10. If poor sleep is paired with chest discomfort, breathing trouble, or fainting, treat that combination as a serious red flag. Sleep can interact with heart and lung conditions, and nighttime symptoms can sometimes be the first clue. Another important warning sign is waking up with a pounding heart, sweating, or a sense of air hunger. That can happen with panic, but it can also happen with sleep apnea or other medical issues. Reflux can also wake you with coughing or a burning sensation, and asthma can flare at night. The point is not to guess the cause, it's to recognize that sleep symptoms, plus cardiorespiratory symptoms, deserve timely medical evaluation. Also note swelling in the legs, persistent shortness of breath, or a new drop in exercise tolerance during the day. If sleep is becoming the stage where bigger symptoms appear, that's not a problem to solve with a new pillow. Moving to slide 11. Sleep problems can also show up as brain and mood changes. The red flag is when the change is persistent, noticeable, and out of proportion to your situation. If you're more irritable, more anxious, or unusually down for weeks, sleep may be part of the story. If your memory feels unreliable, you can't focus, or you're making more mistakes, that matters too. Sleep deprivation can mimic attention problems, and fragmented sleep can make you feel emotionally raw. Another warning sign is losing interest in things you normally enjoy, especially if it comes with early morning waking and low energy. On the other side, if you need very little sleep and still feel unusually energized, impulsive, or wired, that pattern also deserves medical attention because it can be linked to mood disorders. The practical step is to connect the dots. Track sleep alongside mood and concentration for 2 weeks. Moving to slide 12.
Kids and teens have their own sleep red flags, and they're easy to misread as attitude or laziness. Regular snoring in a child is worth mentioning to a clinician, because pediatric sleep apnea can look different than in adults.
Another red flag is persistent insomnia, especially if it's tied to anxiety, ADHD symptoms, or school stress. Watch for daytime sleepiness that shows up as hyperactivity, meltdowns, or trouble concentrating. In teens, a delayed body clock is common, but the concern is when it leads to chronic sleep restriction and falling grades, mood changes, or risky drowsy driving once they start driving. Also pay attention to growth, appetite shifts, and frequent morning headaches. If a child is wetting the bed again after being dry, or if they're waking up gasping, those details matter. The best approach is supportive and curious. Sleep is a health signal, not a character flaw. Moving to slide 13. So what should you bring to an appointment if you decide it's time? A little structure goes a long way. Start with a simple sleep diary for 1 to 2 weeks. Note bedtime, estimated time to fall asleep, awakenings, wake time, and naps. Add a quick rating for daytime sleepiness and mood. If snoring or breathing pauses are suspected, note morning headaches, dry mouth, and whether you wake up to urinate. Also list your caffeine timing, exercise timing, and any supplements, because timing can matter as much as the substance itself.
If you use sleep trackers, treat them as rough clues, not truth, but they can help you spot trends.
The goal is to give a clinician patterns, not perfect numbers. Finally, know the immediate safety line. If you're at risk of falling asleep while driving or operating machinery, prioritize safety first and seek help promptly. If you want more practical sleep guides like this, subscribe. And for a quick check-in, comment A or B. Is your bigger issue falling asleep or staying asleep? This information is not a substitute for medical advice. Energy, focus, resilience, built at the cellular level.